Welcome to the Scan and Plan Tool instructional webinar. This video series was developed by the Chronic Disease Prevention and Control Program at the Nebraska Department of Health and Human Services. The intent of this video series is to help organizations have a comprehensive understanding for how to successfully complete their Scan and Plan tool. This video will focus on reviewing the Strategy-Specific tab as well as the Action Planning tab within your Scan and Plan tool. We'll start by providing general instructions and context to complete the strategy-specific tabs. At the top of every strategy-specific tab is a background section, which highlights the information you'll need to know to complete the remainder of the tab. In that first paragraph, you'll always see the intent of the strategy, as well as the performance measure that our program is responsible to report to the Centers for Disease Control and Prevention on at least an annual basis. That typically provides an overview of what CDC is anticipating states will accomplish as a result of this funding opportunity. That second portion will be for any key definitions. That's where we try to highlight terms that you'll need to know in order to answer some of the statements or think about your action plan. This could include things like diagnosis codes or age ranges for patients or participants within your program. The final portion that's included in the blue box, which again is the background section, is the sample results statement. We thought this might be an easier way for organizations to really grasp the intended outcome of the strategy. And as I mentioned in another video, the screenshots that you'll see within this video may not match exactly what's included within your Scan and Plan tool. For example, the one on the screen now is for undiagnosed hypertension, which may or may not be applicable for your organization. The sample results statement, however, highlights what they were able to achieve as a result of their work on identifying undiagnosed hypertensive patients. They're able to highlight how many of those patients fell within their priority population and also the health outcomes of those who were placed on the treatment plan. We like to give a roadmap to organizations so you know what the anticipated outcome is as a result of your project period. After reviewing the background section so you know the intended outcome of the strategy, your team can start progressing through the strategy-specific tab. Each of those tabs will have at least 3 foundational sections that your organization will need to complete. The first is approaches and practices, and that's where your organization will reflect on what they currently have in place related to the strategy in terms of policies, practices, and procedures. The second section is for strengths and areas of improvement, again, specific to that strategy. And the third portion is for action steps that your organization could take to progress in that strategy. While we'll go through each of those sections in more detail throughout this video, we wanted to note up front that the structure for the strategy-specific tabs is very intentional. Our hope is that your organization is able to review and reflect on the approaches and practices, take into account your organization's strengths and weaknesses, and utilize that information to set realistic action steps. Our hope is that you're able to assess where you're at now and determine where you'd like to go as part of the project period, hopefully to achieve the intended outcome of that strategy. As mentioned, typically the first section that you'll see within the strategy-specific tab will be for the approaches and practices. That's where we're asking your organization to reflect on what they currently have in place in terms of policies, practices, and procedures. In that section, you'll see a series of statements or criteria specific to that strategy. Those statements were developed by the Chronic Disease Prevention and Control Program based on best practices, resource guides, evidence-based guidelines, toolkits, assessments, the whole gamut. We essentially wanted to identify through the literature what an organization would ideally have in place to effectively and sustainably address that strategy. When possible, we've also tried to list the statements in chronological order. So typically an organization would focus on building foundational pieces through statement 1 and 2 and then progress to 3 and 4. That won't be the case for all of the strategy-specific tabs, but in general we've tried to list them in chronological order, in part to help with your assessment of those statements as well as the development of your action plan. To assess where your agency is at within each of those statements, we've developed a 4-point Likert scale. It includes not in place, under development, partially in place, and fully in place. Guidance for this scoring criteria is included on the Instructions tab of your Scan and Plan tool file. I know with this screenshot we've used a clinic Scan and Plan tool, so the language may not resonate, but the specific guidance for your program will be included on the Instructions tab, and the concept for how you go about scoring will still be similar. Essentially, there are 2 aspects we ask you to consider as you're reflecting on to what degree your organization has something in place. First is to what degree they're written or documented. Selecting fully in place would mean that your organization has a policy or some type of process or procedure is written down so that any staff member kind of knows what the formal practice is for your organization. Partially in place would mean that your organization doesn't necessarily have a policy or a process that's formally documented, but it's kind of understood that your organization takes this approach or process. Under development would mean that your organization is starting to generate a policy or have conversation around a process or procedure that can be implemented within your organization. Not in place is kind of what it implies, for your organization doesn't have a policy, nor is there really any process or procedure in place relative to that statement. The second aspect you can consider is what proportion of staff are implementing that particular statement. So being fully in place would mean that nearly all providers within the clinic or staff members within your program or agency are doing something formally to address that particular statement. Partially in place would mean that about half of the staff members within your organization are utilizing that process or approach. Under development would just be a small number or handful of staff members, and then not in place would mean that no one within your organization is doing something relative to that statement that you're reflecting on. The other thing that we want to note, and it's starred here on the screenshot, is that if your team comes together and it's not known whether your organization has something in place, we're encouraging you to list it as not in place. Given that no one in your team knows whether it's in place or not, it might indicate that it's not in place. But beyond that, because it's not easily accessible or formally documented, it may be a strong indicator that it's not in place. Well, we'll have a demonstration video where we complete a sample scan and plan tool within Microsoft Excel. We wanted to include a screenshot of what a sample completed tool would look like so we could point out a few more features of the approaches and practices section. One of the first things that you might notice is that the response options are color-coded. So in this example, an organization might come together and reflect on that first statement. Is there a protocol that aligns with evidence-based parameters in the diagnosis of hypertension that all staff are using? After conversation, they may decide that it's considered fully in place within their organization, so they select that box. If you select fully in place, it will color code that box to be green. If you select partially in place or under development, it will color code to yellow, and then not in place would color code to red. It doesn't necessarily have significant meaning, but rather they're meant to be visual prompts as you're identifying potential areas of improvement or action steps your organization may want to take as part of that strategy. If at any point you want to change which box the X is located in for a statement, just click on the cell that it's currently in and hit the delete or backspace key. Either of those buttons on your keyboard would clear that cell out, and that would allow you to fill it in the appropriate box. We did want to note that it's important that as you're going through this self-assessment, we encourage organizations not to get too hung up on which bucket that statement technically falls into. We actually implemented the scan and plan tool for the first time in March of 2020 with 16 clinics. We got feedback from a few of them, and quite a few mentioned that they got hung up on which bucket their organization technically fell under. Well, are we partially in place or is it under development? We encourage you to not overthink, and that's partially why we encourage teams to come together to complete this, especially the approaches and practices section of their scan and plan tool. That allows for conversation about to what degree they feel like as an organization they have these policies, practices, and procedures in place related to the strategy. So try not to get too hung up about which bucket your organization technically falls into. Just using your best guess or kind of that gut feeling is appropriate as well, in addition to using the scoring guidance. The other thing that we want to point out is that after you fill in all your response options, at the bottom of the approaches and practices section, you'll get a total score. In this case, the series of response options yields a total score of about 42%, which is color-coded to be yellow. Please keep in mind that a low score does not mean that your organization is performing poorly. Really, these statements are meant to be the top-notch, best practices. This is what your organization would ideally do to be sustainable. And so in some cases, they're really high-reaching. Beyond that, our scale is really about to what degree these things are formally in place within your organization, again, to ensure that what you're doing is hopefully sustainable beyond the funding or project period. But please, especially as you're going through this for the very first time for your pre-assessment, please know that a low score does not mean that your agency is performing poorly. We essentially want to use this as an opportunity for your organization to have conversation about enhancements it might be able to make to better formalize and make approaches sustainable within your organization. The next core section included within the Strategy Specific tab are for the strengths and potential areas of improvement. These are open-ended fields where your organization can list things that might be specific to your agency or provide context for the scoring that you utilized within the approaches and practices section. For strengths, we encourage your organization to think about things that are already in place that you can utilize or leverage to advance the strategy. We encourage you to look back up at the practices and approaches section to see what's already fully in place or take into account other opportunities within your agency, whether it's funding, resources, or staffing, that can really help you advance in this strategy area. For areas of improvement, we encourage your organization to think about the barriers or challenges that exist in terms of advancing this strategy. For this, it may help to go back to the practices and approaches sections to see what's not in place or even partially in place or under development. Think about what prevents your organization from really formalizing something as a policy or a process. This is also a section, because it's an open-ended field, where you may want to revisit the Instructions tab of your Scan and Plan tool to see the Excel tips. That's where you'll have an opportunity to learn the keyboard shortcuts to enter to a new line or to insert a bullet point. While the section is relatively self-explanatory, we also wanted to supply a sample of what a completed strengths and potential areas of improvement section would look like. Here you'll notice that they utilize the keyboard shortcuts to enter to a new line and also utilize bullet points to list out the various strengths and potential areas for improvement. To reiterate what we mentioned on the previous slide, this is really an opportunity for your organization to reflect on the current realities and let the Chronic Disease Prevention and Control Program know what's possible within your organization and where you may run into hurdles. This allows us to have that initial context before the work begins and also track as barriers or successes shift throughout the project period. The very last section of any strategy-specific tab will be for the action steps. As we mentioned earlier, we were really intentional with how we structured the strategy-specific tabs so that the previous sections could be used to guide the action steps that your organization generates as part of each strategy. Here you'll be able to brainstorm all the potential action steps that came to mind as you were filling out that strategy-specific scan and plan tool. It could be that there are specific statements that you want to try implementing within your organization, or based on the potential areas of improvement, you first want to build capacity in a particular area. Here we'll just ask that you list out all the potential action steps, and then for each action step you'll reflect on 4 elements, and we'll go through that scoring criteria on the next slide. Essentially though, we hope to gain an understanding for how important that action step would be to advancing the strategy, how expensive that action step would be, how much time or effort that action step would take, and then the feasibility or how difficult that specific action step would be to implement. That'll give you a total score so you have context for each of the action steps that you brainstorm, and in that final column is the AP activity. That's where you indicate yes, this action step will be included in our action plan, or no, this action step will not be included in our action plan. The importance of that column is that for any action step where yes is included in the action plan activity, that action step will be pre-populated into your action planning tab. Outlined on this slide and also included on the Instructions tab of your Scan and Plan tool is the scoring criteria that our program developed for the Action Steps table. As we mentioned, your organization will brainstorm a series of action steps, and we're encouraging you to think through 4 different elements. The first of which is importance. So for each of the action steps that your organization brainstormed, how important are they for your organizations to implement in order to make advancement or progress on the strategy? A 5 would indicate that that action step is very important if you want to achieve the results of that strategy, and a 1 would indicate that it's not super important for your organization to implement. The second element is cost, and that's where you can take into account the cost for staff time, but also any additional resources or equipment that you might need in order to implement that action step. A 5 would indicate that there's not really any cost affiliated with implementing that action step, whereas 1 would indicate that it's very expensive to actually carry out. The third component is time, and I think the biggest factor there will be staff time. So a 5 would indicate that it doesn't take a lot of time or effort for your staff to be able to implement, whereas a 1 would indicate that it's very, very time intensive or takes a lot of effort within your organization. The final component is feasibility. Again, for each action step, we want you to think through how difficult it is to implement. A 5 would indicate that it's pretty easy for your organization to carry out that action step, but a 1 would indicate that it's very difficult. All of those things should help you take into account what's realistic to include within your action plan, and as we mentioned, that final column allows you to select yes, that action step will be included in your action plan, or no, the action step will not be included in your action plan for whatever the reason might be. And as we've done previously, we also wanted to include a sample completed action steps table. This will give you a sense of what your completed scan and plan tool might look like. Here you'll see that the organization came up with 4 potential action steps in order to advance the strategy. By having this overarching view, you can quickly see which ones are considered important, which ones might take a little bit more time or money to implement, and also how difficult each of those action steps would be. Knowing that helps you hopefully get a sense for which action steps should be included in your action plan for the project period. As noted on the slide, if you select yes in that AP activity column, it means that action step will be automatically populated into the action planning tab, and that's where we'll go next. Here we'll give you a general sense for what you can anticipate within the action planning tab of the Scan and Plan tool. The first section that you'll see on the Action Planning tab are the expected long-term outcomes. I'll preface that I know the screenshot that you see may not match the expected long-term outcomes that are included in your organization's Scan and Plan tool file. That's primarily because we vary each tool based on the health condition that your organization will be addressing. The screenshot here, for example, is for organizations who are doing hypertension work. It could be that your organization has cholesterol, prediabetes, or diabetes. So while the information may not be exactly the same, the concept behind the outcome section will be the same regardless of what health condition you're focusing on. The expected long-term outcomes are the outcomes that CDC anticipates that each state will achieve as a result of their grant work. So these are things that we're trying to measure and monitor as a way to showcase how Nebraska is progressing toward achieving those long-term outcomes. You'll notice that in the expected long-term outcome sections, there are typically 2 tables. That top table is for your overall population. So if you're a healthcare organization or clinic, we'll be taking into account your entire patient population. If you're a program that implements a program like the National Diabetes Prevention Program or Diabetes Self-Management Education, there might be additional guidance so that you can look at all of the participants within those programs. We encourage you to keep that in mind as you look for kind of what that overall patient population or client population is for your organization. We also encourage you to look for specific clues about how the information should be pulled. For example, for the hypertension work, adults are defined as individuals who are between the ages of 18 and 85. You'll want to keep things like the age range and diagnosis code in mind as you're going through the long-term outcomes. The other thing that I'll note about this table is that if the Chronic Disease Prevention and Control Program received the data prior to your organization receiving a Scan and Plan tool file, some of that information may be pre-populated by us, primarily as a way to streamline data collection efforts. It could also be that some of that information is auto-populated based on cells within your own Scan and Plan tool file. So some of that information, as a heads up, may be pre or auto-populated kind of based on the information that's available or how your tool is set up. That second table is primarily focused on the high burden subpopulation or priority population data. We talk about this in more detail in the background video, but a large focus of our funding opportunities with the CDC are to encourage work specifically with high burden subpopulations and or priority populations. The language that's included within your tool may depend on the funding source from CDC, as it kind of varies by our funding opportunity. Regardless though, your high burden subpopulation will be a subset of your overall population that is probably more high burden when it comes to your health condition. So in this case, we're looking for those individuals or patients who are more at risk of having hypertension or uncontrolled hypertension. So all of that information will be based on a specific subset of your overall population. One important thing to keep in mind is that ideally your organization determines who that priority population is or the high burden subpopulation is based on data within your organization. one. It could also be that you have more than one priority population or high burden subpopulation as you're going through the data. But please keep in mind that this should again be a subset of the population so that you can focus interventions on that population in hopes of helping them achieve better control for whatever health condition you happen to be focusing on, whether it's blood pressure, cholesterol, or diabetes. Given that it's the long-term outcomes that really drive the work of organizations, we thought it would be helpful to talk through a sample completed long-term outcome section and how an organization might go about setting targets. I'll again mention that the screenshot here that you see is primarily focused on hypertension, but the process that I talk through would be applicable to any health condition that your organization is focused on within the Scan and Plan tool. The other thing that I'll mention is that the pink font will reflect information or data that your agency inputs into the expected long-term outcomes section, especially since information may be pre-populated by our program or auto-populated based on other cells in the table. We thought it would be helpful to have a really easy delineation between what information is already pre or auto-populated and what information your agency has input into the file. So if it's pink, it means your organization has put in that number. We really want organizations to think intentionally and realistically about what they can achieve during the project period. Like I said, we really want those long-term outcomes to drive the work, and so you're able to have this frame what your action steps are and then use that to set your target. In this case, for example, there's a clinic that has 600 patients who are between the ages of 18 and 85. Among those, 350 have diagnosed hypertension. Now, among the 350 who have diagnosed hypertension, 203 have already achieved blood pressure control. So currently, at baseline, 58% of their patients with hypertension already have their blood pressure under control. They can use that information, look at the action steps below within the action plan that they're proposing to work on, and utilize that context to hopefully set a realistic target that they hope to achieve during the project period. In this case, they're hoping to go from 58% control rate to 64%. Your organization would then go through a similar process of looking at baseline data and setting targets for those high burden subpopulations. Again, the high burden subpopulation or the priority population identified by your organization is done so through the use of data. It gives you an opportunity to look at your overall population and identify subsets that maybe need a little bit more intense intervention or may be more at risk for a particular health condition. Again, the pink that you see is information that your organization would be populating into the cell. So in the screenshot, you'll see that this organization has identified two high burden subpopulations for hypertension. The first would be African American males between the ages of 45 and 70, and the second would be women between the ages of 70 and 85. Within each of those, they would again go through that similar process where they look at baseline data. You might remember from the previous slide that a total number of 350 adults were diagnosed with hypertension within the clinics. Here you'll see that among those, there were 63 who fell within the high burden subpopulation of African American males between 45 and 70, and then there were 75 who are part of the diagnosed hypertension group, who are women between the ages of 70 and 85. Here you'll see, though, that they have slightly lower percentages when it comes to those who have been able to achieve blood pressure control. So previously, when you look at the clinic overall, 58% of those who were diagnosed with hypertension had their blood pressure under control. You'll see within these high burden subpopulations that for that top one, only 44% have blood pressure control, and then women ages 70 to 85, only 41% have achieved blood pressure control. That's what prompted the clinic to look more closely within those specific high burden subpopulations. So you go through that same baseline data collection and then utilize that as a way to set targets. So again, for this particular clinic, 44% of African American males between the ages of 45 and 70 with hypertension have achieved blood pressure control. Their goal through the project period is to increase that so that 50% of that population have achieved blood pressure control. And then for women ages 70 to 85, they started at 41% and hope to achieve the 45% goal by the end of the project period. This is a really good opportunity as you're setting the targets, especially for the priority population, to really look at your action steps to make sure that your proposed work will impact those individuals. After going through the long-term expected outcomes, which would be a culmination of the work in all of your strategies, the next portion will be the action plan process, which is broken down by strategy. Again, the screenshot that you see here is specific to hypertension, but the process would be the same regardless of your health condition. That top line will let you know which strategy your organization is focused on. So in this case, it's undiagnosed hypertension. And it also auto-populates the scan and plan score based on the approaches and practices section. Just an easy way to reference to what degree you have policies, practices, and procedures in place within your organization relative to that strategy. That first portion in the action plan is for the expected outcomes. So this is what we anticipate that organizations will monitor and track as part of that specific strategy. In this case, the strategy is focusing on identifying undiagnosed hypertensive patients. So we have 4 measures that the organization will reflect on throughout the project period as a way to monitor progress. So here they would report on the number of undiagnosed hypertensive patients that were identified, and then what proportion of those patients were then recalled back into the clinic. We'll also do a breakdown of the high burden subpopulation, as that's a core focus of our funding opportunity. So it's very likely that if you have expected outcomes by strategy, you'll be looking at your clinic overall or your organization overall, and then doing a deeper dive into those priority populations. After you've again set those baseline and target measures for the strategy, you transition to the action plan portion of that strategy. The first thing that you'll list out are the key partners and or stakeholders who would be involved in that specific strategy. Maybe you're trying to identify an IT consultant to come work on your EHR or data collection processes, or maybe there's a community-based agency within your city that allows you to really enhance referrals or address a particular health condition. It's just an opportunity for your program, as well as the chronic disease prevention and control program, to see external partners who are coming together to assist with implementing the various strategies. Then it breaks down the actual action steps that your organization indicated that it would take as part of the action plan. Again, these are action steps that will be auto-populated based on the information you included in the strategy specific tabs. You might remember we talked about that AP activity column. If you select yes in that, the action step will be pre-populated into this action planning tab so that all the information is right there. For each action step that your agency indicates that they will do, we'll just have you indicate by when you hope to achieve that action step. The person or team responsible is actually an optional measure or an optional field within your action plan in the event that it's helpful for your organization. If it's helpful to clarify who within your organization or which team within your organization will be taking on that action step, you can certainly feel free to include that information on your action plan. I'll note that if at any point you do want to modify your action steps, you would just go back to the strategy specific tab and update the language there, and it will be pre-populated or auto-populated back into the action planning tab of your scan and plan tool. Once again, we wanted to talk through a sample completed portion so you know what to anticipate as you're going through this action planning tab. As with the other portions on this tab, the pink font will reflect information that your organization has input into the action plan. The remainder was already there or auto-populated based on what you included in the strategy specific tab. We'll start with the expected outcomes, which is a similar process to what your organization would go through with the long-term outcomes. Again, these will be measures that are tracked specifically to this strategy. Here, we identified that there were 115 undiagnosed hypertensive patients, and so the organization set a goal of recalling 25% of those individuals. They did a similar process for that high burden subpopulation, which again will be a subset of the overall population. So we'll see that of the 115 that were undiagnosed hypertensive patients, 67 of those individuals fell within the high burden subpopulation they listed earlier up above in the tab. Among the high burden subpopulation, they're hoping to recall 50% of those 67 individuals, although it may be a higher number as they're going through a project period, which is primarily why we have your organization set targets around percentages rather than a specific number of patients. After going through that expected outcomes, you'll then go on to complete the action plan for each of those strategies. Here, the organization indicated that their key partner or stakeholder in this strategy would be their EHR vendor. You'll also see that there are 2 action steps for this strategy. You might remember from a few slides ago that during the Strategy Specific tab, the organization brainstormed 4 potential action steps. Of those, 2 of those had a yes in that AP activity column. So those are the 2 action steps that are auto-populated on this action planning tab. From there, they just have to indicate by when they would like to complete that action step. And in this case, the organization opted to indicate who would be responsible for completing that action step. So based on the pink font, there's not too much information that needs to be completed because that action step is being pre-populated based on your strategy specific tab. I will mention that after you go through this action planning process, it can be really helpful to kind of step back and think about how it all connects to make sure that your organization is setting action steps to achieve those expected outcomes, both for the strategy and the overall long-term expected outcomes. You can kind of see on this tab that it all comes together and hopefully can help you achieve your target goals to meet the funding outcomes. As we close out this video, we wanted to send you off with a few reminders and key suggestions as you're completing the strategy specific tabs and the action planning tab of your Scan and Plan tool. Keep in mind that the strategy-specific tabs are what allow teams to come together to have honest conversation about where your organization is currently at. That top portion, again, will be based on the approaches and practices your organization have in place. We again want to remind you that a low score does not mean that your organization is not performing well. Our scoring criteria is based on to what degree policies, practices, and procedures are formalized in hopes that it makes that more sustainable within your organization. So please don't feel like a low score doesn't mean that your agency isn't performing well. It really just provides an opportunity for you to see where enhancements could be made within your organization and also celebrate the things that are already fully in place within your organization. All of that will help drive the action steps, which then translates over to the action planning tab. Keep in mind that those long-term expected outcomes listed at the very top of the tab will be a result of the culmination of all the strategies and all the action steps that your organization has proposed to work on during the project period. The strategy-specific outcomes will highlight the measures that we'll be tracking to measure the success by strategy. Once you've done the strategy specific tabs and the action planning tab, it's a really great opportunity for your team to sit back and reflect on kind of all the work that's been done. We were really intentional in how we set up the tool and having you assess where your organization is at and do some initial brainstorming and then finalizing those action steps on the final tab of the Scan and Plan tool. We really want your organization to reflect on whether the action steps that your organization has proposed will help you achieve your targeted outcomes, especially when it comes to the high burden subpopulations and priority populations that your organization identified. We're really hoping that by going through this process, your organization will have identified kind of a way to be successful in your proposed work with the Chronic Disease Prevention and Control Program. If at any point you run into challenges or questions or need assistance as your organization is completing the Scan and Plan tool, please feel free to reach out to the Chronic Disease Prevention and Control Program at the email address listed on your screen. Your question will be fielded to the appropriate team member to make sure that you can get the support that your organization needs to successfully complete the tool.